Torch infections refer to a group of infections that can cause serious health issues in newborns if the mother contracts them during pregnancy. These infections can pass from a pregnant woman to her developing fetus and potentially result in congenital anomalies or other complications. TORCH is an acronym where T stands for Toxoplasmosis, O for other infections that include syphilis, varicella-zoster, parvovirus B19, HIV, and others. R for rubella or German measles, C for cytomegalovirus, H for herpes simplex virus. Toxoplasmosis is caused by the parasite Toxoplasma gondii, often contracted through consuming undercooked meat, contact with infected cat feces, or contaminated soil. Other infections include syphilis, a bacterial infection usually transmitted sexually, but can pass from mother to fetus, or congenital syphilis. Varicella-zoster, a virus causing chickenpox, can lead to congenital varicella syndrome. Parvovirus B19 causes fifth disease, can result in fetal anemia. HIV, that can be transmitted from mother to baby during pregnancy, birth, or breastfeeding. Rubella, viral infection that can lead to congenital rubella syndrome if contracted during pregnancy, especially in the first trimester. Cytomegalovirus, a common virus that can be transmitted to the fetus, potentially causing hearing loss, developmental delay, or other issues. Herpes simplex virus can be transmitted from the mother to the baby during childbirth, leading to neonatal herpes, which can affect the skin, eyes, or central nervous system. The term torch syndrome refers to the array of congenital defects or complications in newborns caused by these infections. The syndrome can present with various symptoms depending on the specific infection, but may include growth retardation, microcephaly or small head size, seizures, heart defect, hearing and vision loss, developmental delays, jaundice or yellowing of the skin and eyes, rash at birth. Several factors increase the likelihood of torch infections. Women with compromised immune systems, like those with HIV or on immunosuppressant drugs, are at higher risk. Living in areas with high prevalence of certain infections or contact with contaminated sources such as soil, unvaccinated people, or undercooked food. Women who are not vaccinated against rubella or varicella are more susceptible. Sharing a household with someone with an active infection can increase risk. Diagnosis of torch infections can be challenging, especially if the mother has no symptoms. The following methods are typically used. Blood tests to detect antibodies against specific infections. Ultrasound can identify fetal anomalies, suggestive of congenital infections. Amniocentesis to testing amniotic fluid for infection. Infants may be tested for hearing loss or other defects soon after birth. Each infection requires a different approach. Toxoplasmosis is treated with antibiotics, such as pyrimethamine and sulfadiazine, often alongside folinic acid. Syphilis is treated with penicillin during pregnancy to prevent transmission to the fetus. For rubella, there is no specific antiviral treatment, but vaccination can prevent infection. For cytomegalovirus, antiviral medications may be used for infants, but treatment options are limited during pregnancy. For herpes, antiviral drugs like acyclovir may be given to pregnant women with active genital herpes to prevent transmission to the newborn. For HIV, antiretroviral therapy during pregnancy significantly reduces the risk of transmission to the baby. The best way to prevent torch infections includes vaccination. Women should be vaccinated against rubella and varicella before pregnancy, if not already immune. Washing hands frequently, especially after handling raw meat or coming into contact with cats or soil. Regular checkups and testing for infections during pregnancy can help catch and treat infections early. Avoiding undercooked meat and preventing exposure to known carriers of infections. And that's all for this video. If you find this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.